Hello everybody, this is Dr. Kalpana Sringar from Prakruthi Charitable Foundation. Welcome to my channel, Tuning a Fragile Mind. Today I am here to talk about psychosomatic disorders. We come across so many people with so many problems, but it is always good to know whether there is a possible cause of a mental disorder attached to the physical ailment. Many a times we bleep through the thing and we say that, okay, this person may be suffering from this. But many a times there may be a deep-rooted psychological factor that is causing the distress in this person, which comes in the form of a physical ailment. Many a times what happens is people become restless, they complain of chest pain, breathing difficulty, or they may say that they are they're suffering from dryness in the mouth, and they cannot breathe properly, they cannot stand in a place. So all these could be related to certain stress levels in their body. So stress causes a lot of problems which further lead to the physical ailments. There's a lot of confusion between the physical problems and the psychological problems. One leads to the other many a times. People complain of very serious problems. Supposing a person has a tooth pain, he or she may think that they may be suffering from a kind of malignancy. They try to mimic the symptoms. Sometimes if they have a little bit of breathlessness because they have exerted themselves a lot by exercising or walking, they may think that they are having a cardiac problem. They may think that they are going to have a heart attack. Supposing they are having extreme grief because of a loss of some person at home, or loss of a friend, or if they listen to somebody telling them about some person's death, they may start mimicking the same sort of symptoms. Supposing a person has died of a heart attack, this person may also feel that the symptoms are similar that he is suffering from, and he may think that he'll also end up with a heart attack. So many a times they go into such sorts of behavior where even if they go through a number of tests, they get obsessed and they go and get all the tests done. Even if all these battery of tests turn negative, and if everything is all right from head to toe, still they feel that something is missing somewhere, and that is why they are having the problem. The basis being some sort of a stressor in their life. So once these stresses are eliminated from the system totally, when you feel totally relaxed with your mind and body, these things will not get precipitated. You'll have no psychosomatic problems. There is a deep underlying basis for having a psychosomatic problem. I'll give you an example. A lady walked into the clinic one day, and she complained of giddiness, and all of a sudden she just fell down, and her body was totally moving, her hands and legs. After about 5 minutes she got up. I asked her, what's the problem? What happened to you? Do you remember what happened to you when you fell down? She said, yes, I remember what happened to me. That's the first indication that it is a hysterical problem. It's a conversion reaction. She really did not throw a fit, but she made everyone feel that she was throwing a fit. There is a reason behind this. She had problems at home. Nobody bothered to take care of her. They just isolated her because she was a short-tempered lady. And even her husband tried to avoid her because she was very brash in her talk. So she wanted to gain attention. What is the way to gain attention? By falling down and showing that she's thrown a fit. She had learned to mimic the same symptoms as if she's getting a seizure. Like this, there are several sorts of psychosomatic problems. One is a somatoform disorder, wherein the physical symptoms will be like extreme fatigue, sweating, probably excess of urination, the urgency to use the bathroom frequently, or symptoms of diarrhea, or even extreme cases of impotence, sexual dysfunction, premature ejaculation. All these are interrelated. They have a basis for this, and they want people to understand that they have been suffering from a certain ailment. Most of these psychosomatic problems, you can say, are to gain attention. When there is total negligence from everybody, people start behaving in different ways. And you must have heard of hypochondriacs. They always have something or the other. My leg is paining, or my hand is paining, or I have a headache, I have such symptoms and I cannot function. I just want to isolate myself, I just want to relax. But where's the relaxation? When the person is constantly complaining of something or the other. So these people are categorized under hypochondriacs. The other example is like what I gave you previously, the conversion reaction, wherein it's a hysterical symptom. Like the lady who fell down and acted as if she had epilepsy. There are people who complain of sweating or extreme palpitation, and they feel that they may throw a seizure, or they may get a heart attack. So these are also seen in patients who suffer from conversion reactions. So likewise, there are so many types wherein they try to show that there is something going wrong with them. Apart from this, we also have what we call the body dysmorphic disorder, where they always look at themselves in a mirror. They feel that something is wrong with them. They try every angle to see that they look perfect. Supposing there's loss of hair because of certain problems, they may link it to something else and say, maybe I'm having malignancy and that's why I'm losing so much of hair. I can also give you an example of a girl who's obsessed with her face. She feels that she's got a lot of wrinkles and she needs to go for Botox. She says that in one angle I don't look nice, in the other angle probably I may look nice, but I need a correction. I need a correction surgery and maybe even Botox. So there are so many people who get obsessed with these things. All these are categorized under the body dysmorphic disorder. And as I told you, in psychosomatic problems, you can also see people acting as if they have become blind, as if they cannot speak. Their speech is totally cut off, and they just sit in a corner. They do not want to talk to anyone. They isolate themselves because they feel that they're not worth being seen. At the same time, there is a hidden factor that they need attention. We came across a boy who was brought from Maharashtra, and this boy had stopped talking for nearly 4 days. He pretended as if he could never talk again. He never told his name. He could never say where he came from, nothing. He said that he could not talk. It was just non-verbal communication. So we asked him to open his mouth, told him to put his tongue out. He said he can't do that. Then he says We gave him a glass of water. We said, swallow it. He said, even that was becoming difficult for him. Then we made him sit down. We interviewed the family members and asked them what the reason could be. There was a major problem. There was some grief attached to it. He lost his grandmother, who was very, very close to him, and she had a stroke, and she had lost her speech. So this boy had seen his grandmother unable to talk, unable to move, and finally she passed away. And with that in his mind, he started behaving in this manner, and he had stopped talking. So we had to, put him through the many sessions of psychotherapy and behavior modification therapy, and then he came out of it after a week's time. So cases can become so severe at times, wherein it takes time for you to make them all right. These conversion reaction cases, they have a problem with the neurological system. As I told you, the case which fell down pretending that she was having a seizure. So there are so many psychosomatic disorders, and people get frightened, family members get frightened. They feel that, okay, she or he may be suffering from a major life-threatening disorder, and so they take them for investigations and see. But when all the tests are normal, when everything is normal, then what can you say about it? You can say that there is an underlying cause, a psychological stressor, which is causing this problem. So these people who suffer from such psychosomatic problems need a lot of psychotherapy sessions, without which they cannot come out. Many a times they even do not need medication. They need medication only when the symptoms become very, very severe, when they go into severe depression. And this happens in most of the people who have the body dysmorphic disorder, because they're worried that something could happen. And they feel so frustrated with their lives that something is wrong with their face, something is wrong with their nose or the eyes. And it goes to such an extreme case that they start attempting suicide. We have seen a few cases who have committed suicide and who have died. So body dysmorphic disorder can lead them to such an extent where they totally get frustrated and destroy themselves. So at that particular time, these people really need to be medicated to get their depression under control. They may become insomniac. They may not see themselves in the mirror again because they're frightened to see, because they feel that there is some flaw which can be noticed by others. So the therapy for such people is totally a different thing altogether. Many a times we ask them for a few days not to see their face in the mirror. We say, okay, you don't see your face in the mirror. You just avoid seeing a mirror or your image anywhere. We tell them not even to see the reflection, the shadow, I mean. So after a course of psychotherapy sessions, we slowly start showing them their face in a mirror. We ask them whether they still can see some flaw in them. It is not easy. They don't believe you. They still feel that they have it. So they have to go through a series of psychotherapy sessions and behavior modification therapy sessions wherein they feel that, or they become confident of themselves and then forget about these disorders. There are many times when these psychosomatic patients, they even confuse the doctors. They go to the clinics and they tell the doctor all sorts of problems that they are facing. Supposing they have a stomach ache, they say, no, you see, the ultrasound report that has been shown may be wrong. I may be having a tumor in the stomach which is malignant. And they confuse the doctors to such an extent, and the doctor has to send them for so many tests. And even if everything is normal, if everything is proved right, still these people feel that there is some loophole somewhere, or the doctor is trying to hide some facts from them. So it becomes very, very difficult for any doctor to convince these people who suffer from these psychosomatic disorders. So if you come across, and especially during the pandemic, even if they get a little bit of flu, a little bit of cold, a little bit of cough, because of some weather change, they feel that they may be infected with the new Omicron virus. We saw a patient just 2 days ago who thought that that she had got Omicron, that she was infected by Omicron. So we had to convince her that she has no symptoms. She went for a test. The test results were negative, but still she had a feeling that, no, I must be having this. Many a times what happens is people have a habit of just going and checking their temperature, taking an oximeter to test their oxygen levels. They become totally neurotic. Something may happen to me, so let me check my temperature. Those digital thermometers, they may show an increased degree. You should not get scared that you have fever or you have caught the disease. Don't worry about all that. Viewers, learn to remain safe. Use a mask. Don't enter crowded areas. Sanitize your hands. Everything will be all right. Don't get worried. Don't become psychosomatic. All these problems will get resolved. Your mind and body should be relaxed. Try to reduce your stress levels as far as possible. Divert your mind into things which you really like to do. Age doesn't matter. Whenever you want to learn anything, learn. But try to divert your mind in different activities and enjoy whatever you are learning. Every day is a boon to us. We do not know what is going to happen to us tomorrow. But when we live happily. So thank you for your viewing. And in case you have any problems, Prakruthi Charitable Foundation is always there to help you. Thank you so much.